Autologous stem cell transplantation is and remains the standard of care in young myeloma patient, and we usually use the 65 years old as a threshold for this. However, we know more and more that this threshold of 65 may not be the most appropriate, and there is no reason actually to select exclusively based on age. And this is why there is more and more interest these days on using autologous stem cell transplantation in elderly but fit myeloma. And we know in general that elderly myeloma patients can be very heterogeneous, so one size does not fit all, and this is where I think a very accurate and detailed and comprehensive evaluation of comorbidities, of physical function scoring, geriatric evaluation, frailty evaluation, but also taking into account quality of life issues, patient preference. Putting all this together would probably allow to design the optimal treatment approach for these patients, for these elderly myeloma patients. When we consider the elderly but fit patient, definitely I think we do have a body of evidence in favor of using auto transplant in this group of patients, and actually based on the published literature looking at the real life activity from the registry, the European registry of the EBMT, actually the use of auto transplant in patients above age 65 keeps on increasing. And looking into the results closely, the results are similar to what we see in young patients. So in summary, I don't think age per se should be used as a contraindication to auto transplant. It's more about the evaluation of the patient, and you can be an old myeloma patient, but definitely a very good candidate for auto transplant.